RMD, located in Marin, California, just north of San Francisco. And we're going to do another neuro-relaxer treatment. We have a young face here, and we're just going to try to prevent some fine lines from forming. And also try to open up the eyes and relax the face. So she's very expressive, she told me, so she's going to do some great fun faces for us. So go ahead and frown. So really strong up in here, and then lift up your eyebrows. Pretty strong, and then you can see that it's causing sort of some, not just lines, but you can actually see where the muscle is coming forward, and it's going to cause some uneven rippling in the forehead. And smile and squint. We had you smiling before. We just want to open this area up as well. So we're going to go ahead and do the neuro-relaxer treatment first, sort of between the brows to prevent the frowns. Go ahead and frown again for me. Good, and relax. So we're going to get that strong muscle right there. Frown again. And we're going to get this procerus. Here we see that horizontal line that this muscle will cause across the bridge of the nose. In this case, there are actually two little tiny accessory muscles here and here. A lot of people miss those, and the brow will still come down. So we don't need to treat those two muscles in most people, but in this particular case, I'm going to. So sometimes at the bridge of the nose is a little lower. That's when those muscles really come into play. Okay? It's a little hard to get that area numbed. I've already prepped and numbed her skin, but we don't like to get numbing cream too close to the eyes, so you might feel these first two a little bit, all right? So relax your head against the headrest and go ahead and start your treatment. Are you comfortable?
Mm-hmm.
Okay, good. So we're going to come in here. It's going to be a little close to your eye, but don't worry, I won't poke you. A little pinch right here. So this is this little accessory muscle right in the side. Have you ever had this one treated before?
No, I haven't.
Yeah, so a lot of times people miss those too. So they're kind of tiny, so I'm going to put a little tiny dose in those muscles. Good, you doing okay? So it probably wasn't numb there.
Oh yeah, no, easy.
So we're going to go right in the middle here. This is sort of more standard treatment, right in the middle of between the brows, a little bit lower on the bridge of the nose, and that is the procerus muscle that causes the horizontal line. We're going to get the heads of these two muscles and the tails. Heads are really easy. They're right above the heads of the eyebrows. The tails are a little different in everybody. So go ahead and frown. These are the tails that's what I'm talking about, so we're going to catch that first. I like to treat a little bit lower dose in the tail of the muscle. And in the head of the muscle, which is a little larger, I do a little bit of a higher dose. So 4 units of Botox here, that's 12 units of Dysport, 4 units of Xeomin. So Xeomin and Botox are equivalent. So we're going a little bit closer together here where the heads of the muscles come together pretty strongly on her. So she has a lot of just sort of central motion. All right. So we'll get the tails, we'll get around the eyes, we'll get the forehead. All right. So tail of the muscle on this side. I like to pick up the muscle a little bit, support it, sort of pinch with my fingers. That's just distraction. It just helps her from feeling the injection. And it also really helps me feel the muscle underneath. Go ahead and lift up your forehead. So she's not super strong here. So we just don't want to treat too heavily. She does use the muscle, but we don't want to drop her. We want to keep nice lift. Okay, good. And I sort of push the product in. Don't want it to drift, but we do want it to attach to the muscle. Okay, good. Squint for me. Squint nice and tight here. Smile for me. Look at that. So we want to relax this and open this area up. A little bit on the sides here. And then a little bit lower here. And I'm also going to come right down underneath the eye because I do not want the relaxation on the sides here to cause some horizontal lines right underneath the eye. And that can occur. Turn towards me. Good, perfect. So a little bit right underneath. Relax that little creepiness under the eye, and then we'll come around on the sides, on this side, and you'll be done. Okay. and you're finished. All right, if you want to find out more, you visit us at powermd.com. Take a look at our before and after gallery, or follow us on Instagram, or give us a call, 415-785-7995. And stay tuned for more videos. Thanks for watching.